Nighttime leg nightmare, a pregnancy secret revealed. As an obstetrician with over 30 years experience, I've delivered more than 4,000 babies and cared for countless more pregnant women. There's one pregnancy challenge that often goes unspoken, a nighttime nightmare that affects far more expectant mothers than you might realize. I'm Dr. Stan Yeatts with Stork Advisor. Today, let's consider a problem that's been keeping many pregnant women awake at night. Did you know that almost 1/4 of pregnant women experience a condition called Restless Legs Syndrome, or RLS? There are almost 4 million babies born in the United States each year. So that means almost 1 million women experience Restless Legs Syndrome. That's a staggering statistic. The symptoms often catch expectant mothers off guard. This isn't just about uncomfortable legs. RLS can disrupt sleep and impact overall well-being. Fatigue may even affect labor outcomes. But don't worry, I'm here to shed light on this issue and offer hope. Let's uncover the causes of RLS in pregnancy and explore effective remedies. Let me paint a picture for you. Imagine you're an expectant mother, excited about the new life growing inside you, but as night falls, an unsettling sensation seems to affect your legs. It's not exactly pain, but an irresistible urge to move. The sensation may be accompanied by your skin crawling or itching that it just won't let you rest. This is the reality for nearly 20% of pregnant women in the United States and 30% of pregnant women in other parts of the world. It's a silent struggle that's robbing mothers to be a precious sleep and peace of mind. But here's the good news. Understanding RLS is a first step toward finding relief. That's exactly what we're going to do today. By the end of this video, you'll have a clear understanding of what causes RLS during pregnancy, and more importantly, how to manage it effectively. Now, you might be wondering, why haven't I heard about this before? Well, RLS in pregnancy is often overlooked or dismissed as just another symptom of pregnancy. But the numbers tell a different story. I've seen countless women struggle with RLS, often feeling frustrated and alone in their experience. But you're not alone. Studies show that RLS affects 20% of pregnant women in Europe and the Americas, and up to 30% in Eastern Mediterranean countries. Now let's talk about what's really going on in your body. Pregnancy is a time of significant hormonal and vascular changes. These shifts can cause unexpected side effects. One key factor is estradiol, a form of estrogen that increases dramatically during pregnancy. While essential for your baby's development, high levels of estradiol can interfere with the dopamine function in your brain. Dopamine controls muscle movements. When dopamine activity is disrupted, it can lead to those uncomfortable RLS symptoms. But hormones aren't the only culprit. In my years of medical practice, there's a strong connection between RLS and iron deficiency. Pregnancy increases your body's demand for iron. Mom has to share iron with the baby. If you don't keep up with the iron replacement, anemia can develop. This iron deficiency doesn't just make you tired, it can also trigger or worsen RLS symptoms. Now you might be thinking, it's just a bit of discomfort, right? But the impact of RLS goes beyond just uncomfortable legs. Sleep deprivation caused by RLS can lead to pregnancy insomnia, affecting your overall comfort and health. In some cases, severe RLS has been associated with longer labor times and an increased likelihood of C-section. That's why it's crucial to address RLS early and effectively. Before we move on, let's clear up some misconceptions. Some patients ask, is it because I'm not exercising enough, or is it because of my diet? Well, while lifestyle factors can play a role, RLS in pregnancy is primarily driven by the physiological changes in your body. Another myth may be even fear that RLS is a permanent problem even after pregnancy. The truth is, for most women, RLS symptoms disappear shortly after giving birth. This temporary nature of pregnancy-related RLS is actually one of its defining characteristics. Now that we understand what causes RLS during pregnancy, let's focus on what matters most, how to manage it and improve your quality of life. I remember a patient, let's call her Sarah, who came to me in tears. She was exhausted from weeks of restless nights. Fatigue was taking its toll on her tolerance. She was worried about how this might affect her baby. I reassured her that while RLS can be miserable for her, some simple steps could improve symptoms and help her rest better. That leads to a healthy pregnancy. The baby would be fine. The first line of defense against RLS is often simple lifestyle modifications. Here's some strategies that have worked wonders for many of my patients. Number one, improve sleep hygiene. Establish a consistent sleep schedule and create a relaxing bedtime routine. This can help regulate the body's internal clock and promote better sleep. Number two, avoid caffeine, especially in the evening hours. Caffeine can worsen RLS symptoms and disrupt sleep. Number three, regular exercise. Simply walking in fresh air can be beneficial to mind and body. Gentle exercise like prenatal yoga or swimming can help reduce RLS symptoms. It's best to finish your activity a few hours before bedtime, though. Number four, leg massages or compression. Many women find relief through gentle leg massages or wearing compression stockings. Another patient that I'll call Sarah implemented these changes and noticed a significant improvement within just a few weeks. Sometimes lifestyle changes aren't enough. In these cases, we might consider medical interventions. The most common is iron supplementation if iron deficiency is present. If your blood tests show iron levels are low, iron supplements are important. In severe cases, iron infusions or even injections are needed. It's amazing how iron replacement can make a huge difference and provide relief. In some cases, we might consider other medication, but this is done cautiously and only when the benefits outweigh any potential risks of the pregnancy. Now here's some more good news. Managing RLS during pregnancy doesn't just help you in the short term. By addressing issues like iron deficiency and improving sleep habits, you're setting yourself up for better health in the postpartum period and beyond. Then you'll be better equipped to care for your new baby. Many of my patients, including Sarah, have said that the strategies they learned for managing RLS symptoms help them maintain better sleep habits even after pregnancy. Now that you're armed with knowledge about RLS in pregnancy, it's time to take action. Here's what I recommend. Consult your healthcare provider. If you're experiencing RLS symptoms, don't suffer in silence. Reach out to your pregnancy healthcare team. They can perform necessary evaluation and provide personalized advice. Implement lifestyle changes. Start with strategies that we discussed. Improve your sleep hygiene, moderate caffeine intake, incorporate gentle exercise, and try leg massages or compression stockings. Join our supportive community. You're not alone in this journey. Consider joining online forums or local support groups for pregnant women. Sharing experiences and tips can be incredibly helpful. Finally, stay informed with StorkAdvisor.com. For more in-depth information on RLS and other pregnancy-related topics, visit our blog at StorkAdvisor.com. We're constantly updating our content with up-to-date advice that helps others. Share your experience. If you found this information helpful, share this video with other expectant mothers. Your share could be the key to help someone else's restful night. Remember, RLS might be common in pregnancy, but it doesn't have to control your life. With the right knowledge and strategies, you can enjoy restful nights and a healthier pregnancy. As always, I'm Dr. Stan Yeatts. Thank you for joining me. At Stork Advisor, we're dedicated to helping you navigate your pregnancy journey and beyond. Here's to peaceful nights and healthy, happy, and blessed pregnancy. I hope to see you in another video. See you next time.